Hello Dr. Chan and my fellow friends. We are from Group 4 and our group member is me, Nur Nachiha binti Asaha, Ros Hazika Haris binti William, Nur Afikah binti Muhammad Raji, and Liana Farhana binti Mustafa Fauzi. Our topic is Global Development Delay. So, what is Global Development Delay? Global Development Delay, GDD, is a diagnosis of generalized intellectual disability. What is Global Development Delay in children? A child with GDD is one who is considered to have significantly lower in their cognitive and physical development functioning than their peers. It can be diagnosed when a child is delayed in one or milestone categorized into motor skills, speech, cognitive skills, and social also emotional development. There is usually a specific condition which causes this delay, such as Fragile X syndrome or chromosomal abnormalities. However, it is sometimes difficult to identify this underlying condition. Other terms associated with this condition are failure to thrive, which is focused on lack of weight and physical development. Intellectual disability, which is focuses on intellectual deficits and the changes they may cause to development and development disability, which is can refer to both intellectual and physical disability altering development. Delays in development differ from other types of learning disability in that they may improve with intervention and may eventually disappear. For that reason, it is important to be aware of earlier signs of a problem. Some delay and disabilities are linked to exposure to risk factors during the prenatal period. Fortunately, some of these disabilities are preventable through appropriate prenatal health care and healthy prenatal lifestyle choices. Delays can also be normal for your child, and they may catch up with their peers without the need for further intervention. There are 5 types of development delays. First is gross motor. Gross motor is a large muscle movement such as standing, walking, or pulling up. Second is fine motor. Fine motor is a small muscle movement such as grasping object, moving fingers and toes. Third is communication skill and early language. It is the ability to understand words and to use speech at earlier age. Last but not least is cognitive skill. It is the ability to think and solve problems. Lastly is social skills and emotional. Social skills and emotional is ability to interact appropriately with others and show their appropriate emotional responses to others. So, that is my part. Thank you, and I will pass this to Ros Hazika Anis to present about the background our subject. Thank you.
Next, I will present about Aisyah background, which is global development delays patients. So, her name is Aisyah binti Ramli, and her age is 5 years old. How her condition due to delivery is just a normal delivery, but it has a complication due to delivery, and its affect with Aisyah health until now. And how it affect with Aisyah health, it will present to the next slide. And in other words, the delivery effect with Aisyah health, which is the damaged brain. And how Aisyah parents diagnose her disabilities, which is first from her weight, which is Aisha weight is not normal, is not normal than others baby. That's a normal babies, which is Aisha weight is more than others baby. And about from physically, Aisha not like other children, and she cannot reading for this age. She cannot understanding, or but or she can understanding, but she don't know how to react or how to answer people question. So it might take a few times to she thinks how to answer the question, how to answer the question. And last but not least is about due to medical checkup, um, which is with Asha doctor. And when she know that how physically and how motor skill Aisha is not like other babies. So a doctor decide to do some research or diagnose with Aisha health or Aisha condition health, and find the answer. And until her her family know about actually Aisha has problem with global developmental delays. And the reason why Aisha cannot be like other children, such as how to reading, how to answer others question, and how to speaking and others. And the the cause is disabilities. And for now, Aisha still gets a treatment from HKL and like and others treatments, but their parents try the best for find any treatment for their children. That's it. Thank you. Next, I will present about the GDD, which is about the global developmental delays, which is I will present 3 points about these disabilities, which is first prenatal issue, and then the environment, and the last one is about the damage of the brain. Basically, the developmental of disability can concern in just one person. They might involve a cognitive or sensory difficulty, social communication, and also the language problem. This is will someone experience when they have diagnosed with professional help about this problem. And another factors that will affect with someone, such as a motor impairment, adaptive delay, and some combination of this problem. They might have one or more than that in their problem of this in this disability. Another point is lack of access to quality care during pregnancy or delivery as soon after birth can be affect for both mother and also a child also, because it is including contributing of developmental disability. The prenatal risk also have a few factors that will include, such as chronic maternal illness, certain maternal infection, toxin exposure, and nutritional deficiencies. It is about around 10 or 20% or percent of individuals that have some kind of developmental disability, but some of them never know or never recognize that they have a symptom of this developmental disability in their self until they find a professional person in this issue to find either they have a problem and they will diagnose in other hospital to know about their health. For risk factors in the prenatal period will include such as pregnancy include in these pregnancies such as it related complication, prematurity and lower birth weight, and it will infection exposed during pregnancy or time of birth. Based on our case study that we was interviewed before, the parents was talk about how their children diagnosed in this GDD issue. Um, in this point, the parents was mentioned they have a problem during delivery because all complication to delivery their children. So it until now it affect to the children because of have a complication time to delivery the child. Another point about the damage of the brain. Global developmental delay can be caused by damage to parts of the brain either before, during or after birth. The damage may be caused by a blood which is hemorrhage on baby's brain, a lack of oxygen or shortage of blood supply. It will around the time of the birth. As a result, it will due to delay in delivery. Based on our case study that was I mentioned before, the parent was taught about they have problem during delivery to or complication during delivery. So until now it might affect on the damage on their brain of the children, and it also was taught by the same doctor that was diagnosed their children that thought the same thing, that it might be cause of the damage of the brain until it become global developmental delays because of their complication during delivery. So the last one is about the environment. It is 3 points such as poor nutrition, family stress, and child abuse. In this any point that it will affect the children also because it's very important for them for live in safety place. They will feel comfortable in their home, comfortable in their family, in their siblings. There is no any issue because there was a child, there is no any problem, there was no anything about life, so they don't deserve to be involved in this negative environment. So the effect will of course affect in their mental until they they should they should have um, problem about their head that they should not have about it. So because of this problem it will affect the children because of from family first, because the family is important to raise their children, to give the best place, the safe place, and to give the best knowledge for them, because as a children they deserve for it. And that was I mentioned before, they deserve to be happy because they were children, they don't have any problem in this life to responsible to solve about this problem because just because not not good or not in the best place for them. That's it for cause of GDD. Thank you.
Thank you, Hanis, for your presentation about the causes of global development disorder. Now, I, Nur Afika binti Muhammad Radi, will present to you about the symptom of global development disorder or GDD. First, the child will have a problem in motor development where the child may struggle with fine motor skills such as holding a spoon while eating a porridge and tying up a shoelace. Usually by the 1-year-old, they should be able to walk, crawl, or sitting like a usual kid, and by 2 years old, they should be able to walk. The second one is the cognitive development, where the child have struggle with their cognitive skills such as thinking, understanding, and following up an instruction. For example, by the time they reach their birthday, they should be able to point at object. On the second birthday, they should know what common objects are used to. For example, telephone. The third is language or speech problem, or should I say that the child have a communication problem, where the child have struggling with speech and language includes the ability to talk, listen, and receive information. Usually by 4 months, the child able to respond to loud noises, and by 1 year old, the child able to use a single word like mama. The fourth one is social or emotional problem, where the child may have experience difficulties interaction with others. The last one is the aggressive behavior for coping skill. That's all from me. Thank you.
The global developmental delay, as known as GDD, is a condition where a child cannot get along with another children because of their mental disability. They cannot talking like another children. They cannot speak like another children, or sadly they cannot understand what people talking to them. Alright. So the treatment for GDD is not to cure the disease, but it's just a way to encourage the diagnosed children to adapt their life with psychological, educational, social, or emotion. Alright. As the way to help the GDD diagnosis, we come up with 3 ways of treatment, or more like the encouragement for the children who suffer from GDD. Alright, first of all, the kids who diagnosed GDD can be treated through the appointment and schedule follow-up with the pediatrician, psychiatrist, or the speech therapist. This is to help the children to maintain their mental ability day by day and help them to adapt with the environment slowly. So if they can adapt with environment slowly, it is a good turning point for them to get along with another children and make friends. Okay, we go to the second, which is the children with GDD can be helped through the encouragement process and attempt tasks. For example, their parents should give moral support for them and always be with them. This is as the motivation for them to develop their mental and physical ability. If their parents always be there for them, so their emotion become more cherished and they feel like they are appreciated. Okay. Okay, alright. The psychological treatment also needed to as the attempt task for them. For example, they cannot walking, so maybe like the parents should buy the a walker for them for as a baby step for them to learn how to walk. Lastly, the children with GDD can be treated using visual aids such as pictures of ABC, the gesture of hands when we're talking with them, the body language and the facial expression to express our emotion to them. Okay, this is to assist the children to become more comprehensive about the situation they are going through and to recall an instruction